Okay, does it say it's recording?
Yep.
Okay, so my learning objective is that the patient will be able to verbalize understanding of safe infant sleep by stating three aspects to safe infant sleep at the end. Okay, so hi, Angela. My name is Naomi. I'm going to be your student nurse today. How are you doing?
I'm doing well. I'm feeling relieved after a long labor.
Oh, great. Okay. Congratulations on your new addition. Is that your baby girl?
Yes, baby girl.
Oh, okay, wonderful. Well, I would like to talk to you for about 5 to 10 minutes about safe infant sleep for a baby girl here. Is that okay to discuss now?
Sure, yeah, that sounds good.
Okay, great. So just to start off, have you ever heard of something called SIDS or sudden infant death syndrome?
No, never.
Okay. So sudden infant death syndrome, or as we call it, SIDS, is the sudden and unexplained death of a baby younger than 12 months old or 1 year old. More and more, we are discovering that it could likely be due to accidental suffocation while sleeping, but what we do know is that there are ways to prevent it. So that is essentially the main goal with safe infant sleep, and there are other things to keep in mind that we will go over here. Do you have any questions before we dive into it?
No, I think I'm ready to dive in.
Cool. Okay, great. All right, so starting off, until baby's first birthday, babies should sleep on their backs at all times. This includes nap time and this includes bedtime. Some people do worry that babies will be more likely to choke on their backs, but it is in fact the opposite. So, because of the way the baby's anatomy is, the esophagus is behind the trachea. So, when babies are on their backs, they have a clear airway in this position because the trachea is on top. So sleeping on their backs is the number one thing that we can do to prevent SIDS because the airway is so open. Okay. And then as far as the side position, this does make it more likely for babies to roll over on their stomachs. So that's why we don't want that. Some babies do tend to roll over on their own, which starts to happen around 4 to 6 months or so, which is okay. But you should always place your baby to sleep on their backs. And then if you find that they roll over on their own, it's okay. You don't have to flip them over.
Okay.
Does that make sense?
Yes.
Okay, great. Okay, so we did talk about how important it is for baby to sleep on its back at all times, but I do want to mention too, it is really good for baby to have awake tummy time. This should be 100% supervised by an awakened adult. And this is important because it helps with baby's motor development and prevents something called flathead syndrome, where basically just a flat spot on the back of baby's head develops because, baby's on their back in the crib, in the car seat, strollers, basically everything. So that's basically that. Do you have any questions about that part before we discuss sleeping environments?
Okay, so yeah, I do actually. So what if the baby falls asleep in the car seat or stroller or something that and is not laying on their backs?
Yeah, no problem. So if baby falls asleep in a car seat or anything, you should move baby to a firm sleep surface so that they can be on their backs whenever you can.
Okay, so that makes sense. Then I will do that. Sure.
Okay, yeah, great. So for the crib, we do want baby to be sleeping on a firm sleep surface that is flat, 100% flat. We don't want it to be crooked or tilted. We don't want baby to be asleep on a couch, sofa, or armchair because this could potentially be dangerous. Baby could roll off or anything. It is recommended that the crib should have one tight fitting firm mattress and one fitted sheet with nothing else in the crib besides baby for the first year. So we don't want any nursing pillows, stuffed animals, loveys, anything like that until baby's first birthday. And then once baby is 1 year old, it is okay to introduce a lovey or a blankie or something like that. And if you are worried about baby getting a little cold, you can use an infant sleep clothing, such as a wearable blanket. But generally, the rule that we say is that baby should be dressed with only one layer more than you are wearing. And baby should be okay like that.
Okay, all right. So what do we do about pacifiers? Can the baby fall asleep with that?
Yeah, pacifiers are great, actually. We love pacifiers at nap time and at bedtime. This is another great thing that can prevent SIDS, and it's also a great tool to calm baby and relax her. Since you are breastfeeding, I see the best time for you to introduce a pacifier is about 2 to 3 weeks after establishing breastfeeding. So, if that is something you'd like to do in about like 2 to 3 weeks at the earliest. All right, so do you have any other questions? I know this was a lot of information, but I do have some handouts today that will go home with you. That way, if you forget, you can always refer back to it.
Oh, okay, great. Yeah, I never knew that blankets and loveys were not introduced until up to 1 year of age.
Right.
Um,
Mm-hmm.
Now, I do have a question about that too. Are there specification how big the blanket or lovey could be, or any certain type of material?
Yeah, absolutely. So, yeah, once baby's 12 months old, it is considered safe by the American Academy of Pediatrics to have a levy that is not large enough to pose a suffocation hazard. So, I would say something that's relatively light in weight. And if Lovey's a stuffed animal, maybe one that is not bigger than baby, the size of baby. Baby blankets are already pretty good size and relatively small, so those would be acceptable. But yeah, something that's light. And as far as material, it would be best for it to be like super soft and snuggly so that one, baby likes it and will want to sleep with it. And number two, that it wouldn't be scratching or irritating to baby's skin. Does that help?
Oh, yeah, thank you very much. You did.
Okay, perfect. All right, so that's really all I have for you today. But just to make sure that my teaching was useful and that you do understand, would you mind repeating back to me just a quick summary of safe infant sleep?
Okay. Yeah. So we're looking out for things called SIDS, which is
Mhm.
sudden infant death syndrome. So the best way to avoid that is the baby needs to be on their backs at all times. That's naps and bedtimes.
Mhm.
Don't try to do side position because they can roll over to their tummies. And um, now you did say something about that tummy time is okay if the baby is awake and the adult is awake as well.
Yes.
And we want to develop, not have them develop a flat spot in the back of their head.
Mhm.
And then you did state too that if the baby falls asleep in the stroller or car seat, to put them in a flat surface,
Mhm.
because we want them on their backs as much as possible.
Mhm.
And then as far as the crib goes, you want them to be in a crib and it's firm mattress and nothing else in the crib with the baby.
Yes.
So,
Mhm.
and then any kind of blankets and or lovey should be within after a year of age.
Mhm.
But you did say that pacifiers are good for them. So it says to prevent the SIDS and it's to calm the baby down. But you
Mhm.
did say because I'm breastfeeding that I should wait about 2 to 3 weeks to introduce the pacifier.
Yes.
Okay.
Mhm.
And then after about 12 months, you said that I can have a blanket that's not irritating to the baby if the baby likes it and it's the size of the baby, correct?
Yes. Generally. Yes. Wow. Okay. Sounds like you really got it down. And again, I will be sending some resources home with you, so don't worry. I know it was a lot. Um, and yeah, so great. I will let you and baby get some rest, and I'll be back in about an hour to check on you. Okay.
All right, thank you.
Okay. Cool. And then I did just want, for the recording, did just want to say that Angela did repeat back at least three safe infant sleep aspects. So the learning objective was met.
Yes.
Cool. Okay. Let me pull it up here. Okay. I'm ready when you are.
All right. So the mother I'm entering has questions about umbilical care cord care. Sorry. After my teachings, the patient will verbalize and demonstrate good umbilical cord hygiene. Okay. Good morning, Mrs. Wildcat. My name is Angela, and I'll be your student nurse for today. How are you and your baby doing today?
Good morning. We're both fine. Just wanting to go home. I can't wait.
Oh, I bet you can't wait. That's awesome that you're both doing great. Now, before discharging, is there any questions that you have?
Yeah, actually, I am a little scared on what to do for my baby's umbilical cord. I'm afraid that I'll knock it off early and hurt my baby more. Are there any things I can do when I get home to prevent that?
Oh, for sure. Yes. So there's some things that we can do. So now just generally just to let you know, it does take about 1 to 2 weeks for the cord to fall off. But there are, like I said, some things that you can do to keep the umbilical cord safe. First off, is to keep the cord clean and dry until it falls off. What you want to do is you want to keep the cord exposed to air. So it's important when you're changing your baby's diapers is to not cover the cord with the diaper. So let me demonstrate on the technique to keep the cord safe, okay?
Okay.
Go ahead and grab the baby and I'll show you first and then I'll go ahead and have you do the same, okay?
Okay.
So we're gonna see here, so you got the umbilical cord here,
Mm.
okay? So when you're putting the baby's diaper on, you're gonna put it as normal,
Mhm.
and but when you come to this level, sometimes they have a notch here, but it's gonna go over the umbilical cord as you can see. So
Mhm.
what you're gonna do is you're gonna fold it down and you're gonna have it go under
Okay.
so that
Mm.
way it's not touching the umbilical cord and then do it as normal with with the diaper. So
Okay.
that it's not hurting the umbilical cord, okay?
Mhm.
So if you can, let's see if you try it and see if you could do it.
Okay. And I'm a little nervous, but I think I got it.
Okay.
Okay. So this is my baby. So we're gonna do it from a side angle so that we can say that this is the umbilical cord.
Mhm.
Okay. So I get the diaper. And it's this on the back, right?
Correct. That's in the back. That's
Okay.
yes.
Okay, so we're gonna put it on like this. And then we're gonna fold it down in the front. Oh, in the
On the
front.
part, yes. We're
Okay.
gonna pull it down a little bit. Yep. And
Like
then
that?
yep.
Okay.
And we're gonna make sure that the umbilical cord is right above that fold.
Okay. It's a little sideways because my stuffed animal doesn't really work.
Yes.
But
Fine.
but it would be like this. And then you fold it down, right?
Yes, you fold it
Okay.
down. It looks
Okay.
perfect, just like
Okay.
that.
Okay. I think I got it. Okay. Thank you.
Awesome. Okay. All right. You did awesome, Mom. Um, now, if there is ever a problem where, like I said, you cannot fold the diaper down because it's too small or whatever, you can, like I definitely say, cut a notch in the front of the diaper to make a space for that cord. Okay.
Okay.
So that's another technique that you can do. So, but otherwise you did awesome, Mom. So now if your baby stump gets dirty from urine or bowel movements, because it can get everywhere,
Mhm.
wash it off right away with water, and then gently like pat the stump dry. So you just get and you just kind of like wash it around it and pat dry, okay?
Okay.
Now, another way to keep the cord safe is to give your baby a sponge bath instead of bathing your baby in a tub or sink. So when you're cleaning the area, first step, you must always wash your hands before and after you clean the stump. That is to decrease the risk of infection.
Okay.
Okay.
Mhm.
So of course, you can keep the cord clean by wiping around the cord with some mild soap um, and water on a washcloth. This will not hurt the baby.
Okay.
So again, gently pat the stump dry. Um, when the cord falls off, then you can bathe your baby in a tub or sink. So you can immerse them with water. Okay.
Okay.
All right, Mom. What should you do before cleaning the cord?
First thing I do is wash my hands.
Okay, and then after you do it
And
as well?
after I also make sure to wash my hands.
Yes. Okay, again, that is to decrease the risk of infection for your baby, okay?
Okay.
So please don't be tempted to pull up the cord, even if it's hanging. It will fall off on its own time, okay?
Okay.
So when you're clothing your baby, make sure to put the baby in loose fitting clothing so that the cord can move easily underneath and not be constricted, okay?
Okay.
Now, sometimes the cord may show like a signs of redness or a little blood might be there. and it might smell a little, but this is normal, okay? So now umbilical cord problems are uncommon, but it's good to know the signs of infections and know that when is the time to call your doctor, okay? So some signs are like a pus, so you'll see like a yellowish fluid around the base of the cord, and the smell is much worse
Okay.
than it normally is, okay? If you see tenderness around the base of the cord, you baby is crying when you touch the cord or skin around the area, and especially if your baby is having a fever, that is an indication for infection. You need to call your physician.
Okay.
Okay.
Mhm.
So also, you may notice after the umbilical cord has fallen off that there might be a moist red lump around the baby's navel. And if it lasts more than 1 week, that is something you need to call the doctor about. That could mean that could mean there could be an extra tissue. It's called an umbilical granuloma.
Okay.
But the physician can treat this, okay? And it's minor if you look out for the symptoms. Okay, mom. When is it time to call the doctor?
So I need to call the doctor when I see pus or if the cord smells really bad, or it's red and tender, like around the cord.
Yes.
Okay. And then I also need to call the doctor when my baby cries when I touch the cord, um, around the, oh wait, no. When my baby cries when I touch around the cord area. Okay. And then I need to make an appointment to see the doctor if that happens. Another sign is if I see a red lump around the navel that lasts more than a week after the cord has fallen off. You said that this is something called an umbilical granuloma,
Yes.
right? Okay, the red lump. Okay. And the physician can treat this.
Yes, awesome. Yeah, it sounds like you have a great lead start, and definitely taking care of that umbilical cord. Now, again, how long does it take to have the umbilical cord to fall off?
You said 1 to 2 weeks, right?
Yes, so
Okay.
don't feel worried. Don't be worried if it
Okay.
feels like forever for that cord to come off.
Mhm.
So definitely, if you follow these guidelines, then you will not have to worry about your baby. Now, before I go, do you have any other questions?
No, I don't think so. I think I got this down. I feel a little more confident now when we both go home.
Oh, that's good to hear. So, well, if there aren't any more questions, here's your call light. And if you need assistance, please don't hesitate to push the button. I'm going to get started on your discharge paperwork, so sit tight.
Okay, thank you.
Awesome. So at the end of this teaching, the mom is um, verbalized understanding on the different techniques of keeping umbilical cord hygiene, as well as looking for signs and symptoms of infection.
Perfect. All right, do I stop the recording now?
Yeah.